Welcome to Public Health Matters, where we talk about matters in public health. My name is Bobbie Bagley, and I'm the Director for the Division of Public Health and Community Services. And I have with me today a very special guest, Nicole Tsoulakas, with ALTRIX Primary Care, a new primary care agency in Nashua. Nicole, it was very exciting to meet you, and I'm very impressed with the services that will be coming to Nashua and offered for our community. Can you tell us a little bit about ALTRIX and about why you decided to open up your practice here in Nashua?
Yeah, so good afternoon, Bobbie. Thank you for having me here today. It's a pleasure to be here. As you have said, we have just opened ALTRIX Primary Care, which is a full primary care office across the lifespan in Nashua. And our umbrella affiliate is America's Nurses. So there was a vision of a group of folks who wanted to design and open nurse practitioner-led primary care, with the foundation of the focus being unhurried, whole health, and across the lifespan care for the first community being Nashua. So the goal is to expand over time to other primary care offices, to open other ones, but we chose Nashua to fill a need. And there's a shortage of access for primary care for this community, for many communities, but this community too, excuse me. And we thought that this would be a good place to start. And so our hope is to help support the community efforts to ensure that the population in Nashua has full access, for those that do not, to primary care and preventative services. And so you've been very gracious already to collaborate with me, and join forces to help keep the community healthy.
And Nicole, I love the mission of ALTRIX Primary Care, and you mentioned part of it. The mission is to provide unhurried, patient-focused primary care for individuals and families. And I love the fact that that unhurried is part of your mission. So can you tell us a little bit about why that was important for you as providers to have that included in your mission?
I think that we can all relate to an experience where we go to see our primary care and we may have a complaint that drew us to that visit or requested that visit, and we may have other issues that we certainly would want to address, and they could be running a little late, or we feel very cognizant of their time. And we don't want people to feel, any of our primary care, to feel that they don't have a platform where they can express all of their concerns and not feel pressured to be clock watching, and feel comfortable to know that we want to listen. We want to get the whole picture. And that's not to say that other people don't want to listen. But we're building the clinic, and we've built the appointments to allow for that time.
Yes.
So we're looking at, as a new patient coming in, you're looking at 1 full hour, which is about what it takes to really go through someone's history, and any complaints, good or bad, things that they want to share with us, and follow that with a very thorough physical exam. So 1 hour is a good amount of time to start that process, and we've built in 30-minute follow-ups. And so if you come in for a different reason, you will get 30 minutes of our time.
And that's really important, because it's so important for clients or patients to feel like they're being listened to. Mm-hmm. And sometimes when people go to talk about whatever their issues are, they may not come right out, but having that amount of time gives people the opportunity to tell their story.
Absolutely.
And to really be heard.
Absolutely. And you find if you allow people to express themselves without feeling rushed, and you really have the time to sit and talk with them, you learn so much about maybe even things that they don't realize is actually could become a problem or an issue, or something that they might have not put on their priority list And we are able to listen to that, and we can pick those little pieces out and prevent other issues from happening.
That's amazing. So some of the services that are listed here include annual wellness exams, children's health, such as child health checkups, sick visits, and sports and school physicals. And this is going to be really important because we do find that when that time of year rolls around to get prepared for the athletic season or even some of the sports seasons, that those sports and those school physicals become really important. So that's going to be really exciting for the community to know that there's another place that they can go. You have teen health on here. Tell us a little bit about what you'll be offering for teens.
So teens in general are a unique population. I have 3 children. 2 are teens right now. 1 has segued out of that. And they have different needs than the younger child or the older child or the adolescent, later adolescent, early adulthood. And what we want to be able to do is first recognize that they have unique concerns that, my example will be today with the way the pandemic has been running and the remote classes and the lack of socialization and the pressures that kids are under in general. Some felt that they're coming from their parents, from their social circles, or their peers. We want to be able to support those unique concerns, their unique complaints, validate them. It's a precarious time in your teen years. They want to be heard. They don't want to hear that you'll be okay. Everybody experiences this. We want to be able to validate that.
Yeah, and it is something because we were teens, at
Not
some
that
point.
long ago.
I know. We can say not that long ago. But you're correct. And, we've had certain experiences and it might be really easy for people to say, oh, you'll get through this or everybody goes through this or it'll be okay. And I think it's really important that you have an emphasis on helping teens navigate through things by listening and not so much taking them to that place of it'll be okay, right?
And
but
even when
even
when we know that in our hearts, they do want to be validated. And I'm not sure, a lot of people might be able to relate when my teens say, you don't know, Mom. You don't know. And I may know. I may have had almost the exact same experience, but I know that that's not what a teen is looking to hear. They want to be heard and have the tools to work through it.
Yeah, that's important. Other services that you have, and that the palette here, the menu here is extensive. Adult and older adult health care. And we'll talk a little bit more about that because when we met, you told me where your specialty focus of practice area was before you started ALTRIX primary care. Prescription and immunizations, women's health care, wound care and minor procedures, weight loss, nutritional counseling and lifestyle counseling, workers' compensation evaluations, healthcare education, and chronic disease management for conditions such as high blood pressure, COPD, which is chronic obstructive pulmonary disorder or disease, diabetes, asthma, and others. So it's quite an array of services that are offered. So tell us a little bit about this specialty practice area of services and even your specialty practice area of adult and older health care.
So we're very fortunate to have myself and another provider join in where the two of us complement each other's experiences over the lifetime of our nursing profession. I am coming from 6 years over at the VA where I completed geriatrics on an inpatient unit with veterans. And so we had mostly geriatrics, we had older adults, again, another unique population. It was something that I was very privileged to be a part of, taking care of our veterans. And, they, like many older adults, they also have your chronic diseases, your COPDs, your heart failures. And one of the things that I always liked to do, I like to do it, but it's also a requirement to do, is to try and reduce the amount of medications people collect at that age over their lifespan. And so, which we call polypharmacy. And so I'm excited to bring that here because it's a task or skill that requires you to know the person and understand their own management of the chronic disease, and then for us to step in and actually improve that.
Yes, and it's so important. We have our older population is one of our fastest growing populations in our state, and so the services that are needed for this population, are really, really important. Can you talk a little bit about the weight loss, nutritional counseling, and lifestyle counseling, and how that will be provided?
So we have a large obesity population, not just in Nashua, it's across the country. We're seeing it younger and younger. I dare to worry about what this crisis that we've experienced in 2020 is going to bring for our population that's become quite sedentary. There's a lot that goes into nutritional counseling and being at a healthy weight, and probably the biggest element is access. And so we hope to provide that education to understand what's available in the community in terms of even like farmers markets, where the community can have access to more healthy food. And then, we want to prevent it, but we also want to ensure that, for those who have already entered into this unfortunate diagnosis, that we're also helping them overcome some of the consequences of being overweight, not necessarily obese either, and the long-term effects. And so we have a good understanding of how to support the different age groups. But again, I think access to healthy foods and understanding will be a cornerstone for us being able to participate in this chronic disease.
That is awesome. So I definitely want to welcome you to the Nashua and really to the greater Nashua region, because there's never too many providers, because we want to make sure that everyone has access to services. And so welcome.
Thank you so much.
We talked a little bit earlier, about it taking the whole village, right? To keep our community safe, to help preserve, protect, and promote the health and well-being of our community. And so I'm really excited about ALTRIX Primary Care being in the Nashua area. So can you tell us where you're located?
So we are on Northeastern Boulevard, and it's a new building. Some of the inside of the building is still being built out with other new businesses that will be joining that same area. We're on the second floor. We have elevator access. We're sharing a very large space. We share a waiting area, actually, with Nashua Physical Therapy, which is ideal in terms of being able to meet the needs of our population, like instantaneously. They're literally right across the hall from us. We have 8 exam rooms, state-of-the-art equipment, and it's nice parking lot, and it's easy to access.
And what are the hours of service?
Right now, the hours are 8 to 5. We're new. Our goal is to be able to change with what the community needs. And so over time, we've made ourselves flexible enough. Nothing has been written in stone. And as we get bigger, we hope to get feedback from our patients and are able to meet their needs. And so that those hours, I would imagine, over time will change to be able to take care of our own patients on a more convenient time for them.
Okay. And with the services that are here, from annual wellness exam, children to adults, so you have the whole lifespan.
We do. And it's very exciting. I've spent a lot of time prior to being in geriatrics. I was actually on the other spectrum of women's health, completely different, and some pediatrics and obstetrics, and so and then segued into a little pain medicine. We have one of our providers, our other nurse practitioner, Steve. He is well-schooled in endocrine and diabetes, and so together we have he has a lot of other skills too in terms of hormonal concerns with both males and females, and so together we will be able to really oversee a lot of different complaints and concerns, and even normal things that people go through as they age.
Yeah. And some of the services that you provide here will complement addressing some of the priority areas that we focus on in public health. And so when we're working together, because the definition of public health is society, how society works together to keep the entire community healthy and safe. And so ALTRIX will be a big part of that, that team. We do our community health assessment annually, and we identify priority focus areas. And a lot of the services that you offer here, like I said, are going to be really important to helping us address some of those areas. So behavioral health, nutrition, diabetes, hypertension are some of the priority focus areas that we have. And over the course of the past, we're almost at a year's point now. We've been dealing with COVID now for since March, so it's been about 10 months. And so what are some of the ways in which ALTRIX Primary Care will help address some of what we're seeing in the community with COVID?
So I think ALTRIX is in a good position here to support the Nashua community and the public health efforts. We will be providing COVID testing to our patients. Again, we are very flexible and we'll be able to move our hours and change to what's needed in the community. But our plan is to have 2 separate times during the day. Earlier time to be for screening, not necessarily the exposure, people who want to know, which we want. We want them to be testing the asymptomatic individual. Mm-hmm. And then later on, to preserve PPE, we will take the symptomatic patients that need to be tested, and we will follow through with that. And so if you were my patient, Bobbie, and you came in today and I tested you and you were coughing and you weren't feeling well, I would do the test in a safe environment. We'll have a COVID tent, and I would supply you with the information that you need to be safe, and then follow up with you when the test results. And then I'd probably, based on how you're feeling and how you're managing, and really what your knowledge base is, I may say, why don't you come back and I'm going to rescreen you. And so just to partner with you to make sure that you feel like you're managing. And it also gives you an opportunity to readdress any questions you might have. I can provide more education. And so that's the service in the COVID aspect, pandemic, that we will provide to our patients.
And that is going to meet a great need. Now tell me, what type of insurances will your primary care center take?
So it's my understanding that we will take the major insurances. Mm-hmm. I want to say all, but I can't say that. I don't have that specific information. One of the things I do know is that today there's less unique individual insurances that people struggle with to find providers to take. So our plan is to take the major insurances, and I would love to be able to say every patient, but I think that's also an evolving process too.
Yes. Now, Nashua and the surrounding communities, we have a great deal of diversity, as you may have seen already in the, in the city. Will you be able to accommodate patients where English is not their first language? And if so, how will that be done?
So we do plan to accommodate English as second language, Spanish speaking. We need to meet the needs of the community, and so alienating any specific group is not our priority at all. It's not our intention. And so we'll use interpreter services. One of the things I had discussed with you previously was using electronic devices. And then after that conversation that you and I had, I had spoken more thoroughly with our practice manager regarding how would we do that. Mm-hmm. And so technology is amazing.
Yes.
And so we do have a plan to access that technology as we need it. And like I said, we certainly do not want anyone to be able to feel like they're not getting the full attention, and that we're communicating in a way that you understand.
Yes. Now, will you also be able to offer telehealth? We didn't talk about that earlier, but that you mentioned that the technology and some of the practice are finding that is an important way to reach patients when they can't leave their homes. And so will that be an option that will be
Yes.
offered at ALTRIX as well?
Yes, and so we want the patient to be comfortable. So regardless of how we see you, we will still have those unhurried visits. We want to take all the barriers away, and there may come a time when I'm in a telehealth visit and I have to say, you know what, I actually do need to see you face to face. So we will have that technology too.
That's awesome. That is so awesome.
Yeah, it's
So
exciting.
ALTRIX is a very interesting name. So I'm a person that's into names. So Bobbie means winner of all. Do you know what Nicole means?
Lots of pressure here.
Because I want to get around to how you guys came up to ALTRIX. So I'm a person who likes
Yes,
names.
yes.
And I should know what Nicole means because we have a Nicole at our office. So now I got to do my homework and look up
Yes,
what her
then
name
you'll have to
means.
get back to me.
I know, then I'll have to let you know.
So I don't know. And I think it was picked out of a love of the name by my
Yes,
parents
yes.
versus a meaning underneath it. But ALTRIX actually is Latin, and it means, or can be interpreted as nurse or caregiver.
Mm-hmm.
So yes, it was specifically picked to represent the underpinnings of the practice.
Right. They're run by nurse practitioners,
Yes,
which is
yes,
awesome.
yes. Very
Right, that is-
exciting.
yeah, that is exciting. Now, do you plan to expand? Because right now you have Steve, is it Gutwillig?
Yes, Gutwillig.
Gutwillig, who's going to be there with you as well. Are you looking for expanding, or will the two of you be able to take this charge on and run with this ball?
So yes, we do over time, so long-term plan. So the short term is to open up. We already have patients.
That's awesome.
Yes, and which speaks to the need in the community. And as we grow with our patient population, we imagine our staff will grow along with that, which also offers opportunities for jobs. And then we want to duplicate ourselves. And so over time, so certainly it will take a little bit of time, we will see what's working, what's not working, how we're reaching and meeting the community needs. We want to perfect that model. Once we've have that perfected, we would like to duplicate ourselves in another area that needs primary care.
Nice, nice. So we're coming down on our time. So I just have just a couple more questions, and these are going to go to nurse practitioners as practice providers. So tell us a little bit about how nurse practitioners practice, and what is the strength of getting services through a nurse practitioner.
So I think that the differences or the strengths of a nurse practitioner education is embedded in nursing theory, and it's different, depends on which school the nurse first is educated at, for who their therapist is guiding that underpinning of their education. But ultimately, we approach, and always have approached, and it's embedded throughout our education, that the person is more than the complaint that's in front of you.
Yeah.
And so I believe that for me, it's not something I think about anymore. I don't really remember ever making that transition in my thought process. But if someone comes in and has a broken ankle and they're not going to be out of work for 6 weeks without disability, I will treat the immediate thing that is going on in front of me, but I'm also going to want to know, what are we going to do about you being out of work? How are we going to manage? Who's going to take care of your children? How are you going to put food on the table if you're the breadwinner? And so these are things that we're already discussing in our clinic about what is the access in Nashua. How can we make it easier for our patients to get what they need? Let's do the legwork first and have those that information there for them. And so I think that's a little different than traditional medicine, but not in a sense that one is better than the other. People have real ideas of their own that how they want to see their health care go. And so there really is no wrong answer of who you want to see in terms of a primary care provider. But I do believe that as a nurse practitioner, that it's been a long, forever focus that it's holistic, not in the sense of homeopathic treatment, but more in the whole person, whole health.
Thank you. So tell us a little bit more about Nicole. So we probably have a little less than 2 minutes left. So who is the nurse practitioner, the person behind that mask?
So Nicole is,
What are your hobbies? What are things that you like when you're not working?
So very strong family ties. My immediate family, I'm married. I have 3 children that probably don't want to be called children anymore because 2 of them are teenagers and one's in his 20s, early 20s. I really believe that the person that I am is, I'm just like all of us, very social, but a profound respect and need for my family support, and have those connections. I spend a lot of my summers in Maine, at Sebago Lake, with extended family and their kids, and that's probably what defines me, is my family relationships and my friend relationships.
And you can probably see that play out in your practice as well, right?
I think so.
Yes.
I think it's a cornerstone of who
Yeah.
I am, and the empathy and compassion that I bring to the table is lived through my experiences as a mother, a daughter, a sister.
And as a provider.
Yes.
Yes. Nicole, thank you so much for being with us this afternoon on Public Health Matters. Is there anything else, what's the last thing that you would want to be the resounding thing that you want our viewers to know about ALTRIX primary care in Nashua?
So I would say the thing that I would like to impress upon Nashua community as the most important is we absolutely will treat you as you are part of our family. We understand that there are barriers between providers and patients many times, perceived in terms of getting the knowledge that you need. And we want to break all those barriers down and collaborate with the person and provide them the care that they deserve to have.
So join us next time, and your hostess, Jane Goodman, will be back. But do join us next time as we bring you more information on Public Health Matters.